Page number 191, outpatient department services. So the outpatient department, basically it is the point of contact between the hospital and the community. A lot of patients, as soon as you see the outpatient department, how it is working, how it is functioning, how it is arranged, okay, that will give the first impression of the hospital. Okay, it's kind of a shop window of the hospital. You go to the OPD, you see the list of services or list of OPDs available, list of specialty of OPD available in the hospital, and then you see, okay, in this hospital we have so many services. Next time, if we require something, we can come back, we can follow back here. So this is kind of a OPD is kind of a shop window for the hospital. And it also should have a space for further improvement. Okay, people like they don't want to leave a choice to the hospital when they will fall ill and what service they require. Okay, patient of today and of the future will not remain in the receiving end. Okay, now today's patient, they want to be the chooser, they want to choose what services they want. Okay, so now it is up to the hospital to provide the patient with options. Okay, now the hospitals, the kind of tiles that you use, the kind of ambience that is used in a hospital, it should be very similar to that of a five-star hospital in many aspects. Okay, the people who are in the reception, okay, the first impression of people who are in the reception, their communication skills, their grooming skills. Okay, today's patients, they require a five-star treatment within a hospital itself. Okay, so OPD service of any hospital depends upon like how many emergencies are there, how many accidents are taking place. Okay, are there any unreferred cases, those who have not been seen by an outside doctor? So these are the first time they're entering into an OPD. There are some OPDs who will get their workload from referred cases. Okay, a general physician may refer you to a specialty OPD for a second opinion or a in-depth diagnosis. Okay, so these are the three main areas from where OPD gets its services or OPD gets its patients from. So definition, OPD department is defined as a part of the hospital which has allotted physical facilities. They have their own medical and other staff, okay, in sufficient number. And the main aspect of OPD is it has a scheduled hour, okay, time working period. 9 a.m. to 5 p.m., 8 a.m. to 4 p.m. or so and so. Okay, every hospital has its scheduled OPD hours. Okay, it's not available 24/7. OPDs are not open 24/7 to provide care to the patient who are not registered as inpatients. Okay, patients who come into the hospital but who are not staying in the hospital. For those patients, OPD provides all the care and services. So there are types of OPD. The OPD can be classified into centralized and decentralized. Okay, in centralized OPD, you will see all the different system of medicines. Okay, all the different systems of OPD departments. They are all of them you will find in a same building or a same complex. Okay, that is centralized OPD. All the different specialties: ortho, neuro, nephro, urologies. Okay, cardio. Okay, all these different specialties of OPD, you will find in a same complex or a same building. That is a centralized kind of OPD structure. Okay, even the diagnostic purposes, therapeutic utility area, they all are in the same building, same complex. Okay. And decentralized OPD. In decentralized OPD, the outpatient care is provided in the respective departments of the hospital. Okay, and diagnostic and therapeutic services are also provided department wise. Okay, so it is more, the specialty clinics are more suitable for this type of OPD. Okay, like ophthalmology, ENT. Okay, every floor has a different specialty, and that OPD is present in that floor itself. For example, if first floor is the cardiac floor, okay, cardiac ICU, cardiac inpatient department, and cardiac OPD, cardiac diagnostic facilities, they all are in the same floor. Okay, second floor may have neuro ward, neuro ICU, neuro OPD, neuro diagnostic utilities available in the second floor, so on. Okay, So all the OPDs are not available in the same complex. They are available in the different complex along with the therapeutic and utility services required for that specialty, or even the inpatient ward required for the specialty. So types of OPD based on the type of patients: general outpatients, emergency outpatient, and referred outpatient, which we have discussed earlier. General outpatients are the ones who have not come from any referred sources. Okay, nobody has referred them to the OPD. They have come on their own. Emergency outpatients, they come from, all the emergency outpatients come from emergency cases, accident cases. Okay, referred outpatients are referred by other doctors or other specialists. The importance of OPD. The OPD contributes towards reducing the mortality and morbidity. Therefore, it provides a stepping stone to health promotion and disease prevention. It also reduces the number of admissions to a hospital to raise the threshold of the admission, because you can't admit each and every case that you get in the OPD. Okay, all the cases cannot be admitted. Each and every cases cannot be admitted in the hospital. You have to control the number of admissions. So OPD will take over that burden. It ensures that only those patients are admitted who actually require inpatient care. Okay, who actually require hospital-based care. Only those are admitted, and others can go back to their home. Next, you have functions of OPD. To provide specialist diagnostic medical opinion to the outpatients, to treat the patients on ambulatory basis or domiciliary basis, to make sure you can screen the patient if they require hospitalization or not, if they require inpatient care or not. Okay. Follow up of treatment of discharged patients, provide primary health care for the patients. All the primary healthcare services are given at the OPD. Okay. Access to primary healthcare services are available. Immunization. Okay. Dressing, pregnancy test, okay, antenatal care, all these are available in the at the OPD basis. Coming to the physical facilities in the OPD, you have 4 critical areas: patient's area, clinical area, administrative area, and circulation area. Okay. Size of the OPD, you have based on Bureau of Indian Standards, 2 square meters per bed for entrance zone should be available for them to sit. Seating arrangement should also be available based on this dimensions. 10 square meters per bed for ambulatory zone, 6 square meters per bed for diagnostic zone, and out of total 60 square meter per bed for total hospital area. So the architect, okay, they will take care of all these dimensions. You don't have to mug up this. Okay, architects will usually take care of all these dimensions. Okay, you should just be aware of these numbers. That's it. Don't mug it up. So in the patient's area, you will have entrance. It should be easily accessible. It should have wide door, ramps, and steps. Then there is reception area. Reception counters should be available, sufficient number of reception counters, side room for receptionists to rest, eat food, or be on a break, assistant public relations officers room, public relations officers area. This all should be aggregated in one particular area called as reception. Then you have the registration area, separate counter for new and follow-up cases. Okay, it can be planned as per the need of case. Separate queues can be given. Senior citizens will have one queue, females, male queue. Okay, students or nurses, staff queue, handicap differently abled queue. Okay, different queues can be given in reception. Record room. So record room, separate area should be planned for record room. record desk should be there, depending on the hospital's type. Sometimes OPD will have its own medical record room. Okay. In some hospitals, it is centralized. OPD and inpatient, everything is available in one area. Some hospitals, they have separate record rooms for inpatient cases. Some hospitals have separate records room for OPD cases. Then desk for filling up the requisite forms. Okay, standalone desk can be given with a proper pen and a strong surface to put a paper and write on it. Okay, for patients or patient attendants can fill a form standing or sitting. So those kind of desks should be available. Waiting area, seating arrangements for waiting area, common waiting area for patients as well as the attendant should be available. And not just one waiting area, there is common waiting area where patient attendants and everyone is present. So separate sub waiting area is given where when they get their OPD number, they will go to that specialty, OPD specialty. There is also some benches and desk seating arrangement given for patients who have availed for the specialty OPDs. Outside every specialty OPD, sub waiting area is given. And common waiting area is for everyone, those who have come for OT as attendants, as for operation cases, labor cases. Okay, everyone is in a common waiting area. Sub waiting area is dependent on the specialty. Then public utility services, public toilets, washrooms should be separate for male and female, separate for handicaps, and scale should be one toilet for every 200 patient. Snack bar is optional, separate snack bar. Locker room, clock room. The locker room and clock rooms are for the staffs. And sometimes for patients and their attendants, if they want to keep some valuables. PCO services not utilized commonly these days because you have cell phone, but still PCO services should be provided. Fax machine also can be given in the utility area. Mobile charging facilities, audio-visual material facility, ATM counters are also available. Other, depending upon the number of people, okay, you can give these services. Coming to the clinical area, you will have a sub-waiting area. So once a patient is allotted an OPD for consultation based on whatever specialty he or she requires, they will move to the main waiting from the waiting area, common waiting area. They will reach to the sub waiting area. So sub waiting area will have limited number of seats based on the specialty of OPD. Usually, you will not have not more than 1/3 of the total number of patients visiting the clinic in that day. So you have to calculate how much patients you get on a daily basis. 1/3 of it should be the seating areas available for the patients. Okay. Then consultation room. There is an accommodation for doctor's chair, visitor's chair, table, patient stool, computer table, wash basin, examination couch, equipment for examination, 15 to 17 square meter. Okay. Each clinic should be able to see 100 patients per day. In special examination room, in today's setup, certain gadgets are becoming routine examination tools, ultrasonography machine, 2D echo machine, endoscope machine. Injection room, again, separate sub-waiting area for injection room for about 10 to 20 patients. Depending upon the workload, if yours is a pediatric care hospital, child care specialty hospital, you may require more seating arrangements as compared to a regular hospital. Dressing room, separate dressing room for wounds, a small room which has been allotted only to dress the wounds. Minor OT. In surgical OPD, various procedures are performed in minor OT. Some hospitals, minor OTs are part of emergency department as well. Just adjacent to the emergency department, you will have a minor OT. Plaster cast room, it is always near the orthopedic OPD. Wherever you have the ortho OPD, a plaster cast room will be available next to it. And in some hospitals near emergency room also, you will find a plaster cast room. Pharmacy, some hospitals may have a separate pharmacy for OPD, so separate for inpatient. Radiology also, radiology will serve both indoor and outpatients. Blood bank, usually it will service all the emergency patients, inpatient patients. Rarely OPD services will require blood bank, but it is available for all the departments. Health education, promotion activities, audiovisual displays, posters are put on the walls outside the OPD for people to just go through it when they're waiting for their services. They can just go through it. Then medical and social work, very important aspect of OPD. It works as a bridge between patients, family, communities, and health services. Then counseling services, especially required for teaching and training hospitals. There should be a separate room with sitting facilities, examination table, stool. Then physiotherapy department or a physical medical rehabilitation, this is physiotherapy. Okay. Whoever OPD patients, whoever require physiotherapy or follow-up cases of inpatients who are admitted as inpatients, but after discharge, they still require physiotherapy, they come to this department. Coming to the administrative area, so it will have a room of 15 square meters for every 100 bedded hospitals. If the the bed structure is more, 200, then it is 30 square meters. Okay, so on. So there will be a business office, housekeeping staff's area, storerooms, general storeroom, drug storeroom, linen storeroom, they all come under the administrative area. Then you have circulation area. Circulation means everything that allows movement within the hospital, like staircases, corridors, ramps, lifts, conveyor belts. Okay. 30% of a building should be made up of circulation area. So that allows for the smooth flow of people and supplies within the hospital. Staffing, medical staff. Depending on the specialties you have of OPDs, depending on the OPD days available in the hospital, staffing should be adequate. If anyone is absent, there should be a replacement for medical staff. No OPD should be left in a non-working state. Nursing staff are also posted in OPD on rotational basis. There is a sister in charge, OPD in charge, matron for OPD, okay, assistant nursing superintendent, deputy nursing superintendent for OPDs are available. So they are in charge of rotational duties. Then you have the paramedical staff, technician, security staff, clinical staff, housekeeping personnel. Depending upon the workload, they will also be on rotational basis. OPD in charge with his or her secretariat, PRO, public relation officers, or assistant PRO for OPD cases, grievance redressals that comes from OPD. Coming to the managerial issues that we see in OPD, public relations, this is very important aspect. Not only external public relation, but also internal. Even the staffs, if they have some issues, it has to be addressed, because if the staffs are demotivated, the reputation of the hospital will be impacted. OPD timing, okay, timing should be decided, it should be fixed, and very strictly you have to follow this OPD timing. Be punctual, make sure your staffs are also punctual, consultants and junior staffs, everyone is punctual to these timings that you have set. Then overcrowding, a common issue seen in all hospitals, based on waiting time, waiting list, token number. Okay, these using these strategies, you can deal with overcrowding. Queue jumping. So if you have an appointment system, queue jumping can be eliminated. It's a very bad practice. Okay, like for example, if a VIP patient comes in, you will forego the token system and you will let the VIP patient get into the OPD first. So these kind of things are bad. It will become a bad reputation for the hospital. Appointment systems can be put, online appointment systems, or when they come first come, first show. Okay. Citizens Charter, that is the 11 patients' rights of the citizens and visitors should be listed out in languages used in that region, English, and along with that, whatever is the official language of the region, in those two languages, Citizens Charter should be put out. Absenteeism, visitors should not take it by surprise if the OPD consultant is absent or will not come. So arrangement should be made. Someone's substitute to the consultant should be available so that there is no inconvenience to the visitors. Quality management, 5S technique can be used here. Is very helpful in housekeeping for OPD. Computerization, record keeping and scheduling and appointment system can be well planned if everything is software based or computerized. Grievance redressal system, whatever points of disagreements are there between the patients, visitors, and the hospital staff, it should be reported. A good rapport should be established with the visitors. Okay, whatever disputes are there, amicably solve it. And each and every complaints or grievances should be addressed. Don't let go of any of the don't let go any grievances unaddressed. So that's about OPD services.